Welcome. In this session, we'll be taking a closer look at the screening procedures at visit SO1 and the baseline procedures at visit SO2. In CTN 152, screening and baseline occur at two separate visits. After signing the informed consent form, the study participant will proceed through the screening phase. Ideally, the screening procedures will be completed within a week, but the allowable time for completion is within 80 days of BUP initiation. Ideally, there will be at least 2 days between signing the consent and randomization to allow for baseline data to be obtained from the Fitbit. Participants potentially eligible at the end of screening will return within 80 days of BUP initiation to complete the baseline measures just prior to randomization. Since screening and baseline are two separate visits, the reimbursements are handled differently for each. Participants will receive $130 for completing the screening visit. For baseline participants who complete the visit but do not move on to randomization, they will be paid out $50 at the time of ruling out. However, if randomizing, the participant will be paid at the end of the week 1 visit, which is combined with baseline and randomization. Participants will be paid an additional $10 at baseline for returning their screening Fitbit, but more about that later. As I said, ideally, screening will occur at least 2 days prior to baseline so that you are able to obtain sleep data from the candidate's screening Fitbit. However, we know that sometimes candidates who are bumping up against the allowable study window will want to pre-screen, screen, do baseline, and randomize all in the same day in order to get into the study. In that situation, we ask that you contact the lead node for permission to randomize without the Fitbit data. The last possible day for baseline is within 80 days of the candidate's first buprenorphine dose in the current treatment episode, as verified by medical records or provider report. And remember that baseline, randomization, and the week 1 visit must all occur on the same day. First, let's talk about screening. The intention is that screening will be accomplished in 1 week or less. It may take longer as needed, provided it is completed and randomization is possible within 80 days of BUP initiation. Again, ideally, there should be at least 2 days worth of Fitbit data from screening, but this is not required for eligibility. Although we had verbal consent for completing the pre-screening interview, no additional study assessments may occur until after the participant has completed the informed consent process for the main study. This includes making sure that the participant understands the study, which is documented by their answering each item on the comprehension tool correctly, and ensuring that all signatures, dates, and initials are completed as required. Once the consent process is complete, enroll the participant into the screening baseline segment using the ENRB form. Enter the enrollment information into the study master log, and then set up and save a timeframes worksheet for the participant. Next, complete the locator form and the required releases of information. Finally, you will obtain the participant's ePro password in preparation for completing their self-assessments. We've already shown you the master log on a different presentation, but now I'd like to familiarize you with the timeframes worksheet. Visit Window Timeframes Worksheet is an Excel document which will automatically fill in the dates corresponding to the allowable screening visit window timeframe for each participant. Upon the participant signing consent and enrolling into eClinical, study staff should create a copy of this document, name it with the participant's assigned study ID, and save in a secure electronic folder. Additionally, this Excel document may be used as a backup to provide the dates to collect during the administration of the timeline followback, should the timeline followback calendar generator on eClinical not be available. At screening, you will enter the participant ID in the top yellow box, followed by the participant's date of BUP initiation. The tool will then indicate the latest date consent may occur and both the earliest and the latest date on which randomization may occur in the box to the right. Next, you will enter the date of consent in that final yellow box at the top, and the sheet will autofill dates in which screening is allowable in green, and the latest allowable date for randomization in yellow. In addition, the 30 days prior to consent will autofill to use in case the timeline follow-back calendar generator is not available at that time. Taking adequate time to ensure thorough completion of the study locator information form is the initial retention activity for each participant. This form specifically asks for various ways to contact the participant directly, as well as the opportunity to indicate other persons or locations that might assist in getting a message to the participant about the study. It is critical that study staff obtain as complete a set of locator information as possible. It is recommended to get at least 3 contacts who do not share an address or phone with the participant. Now, some participants may feel uncomfortable with the idea of study staff talking with other people about them. If the participant hesitates about providing a sufficient number of contact information, staff should discuss any confidentiality concerns the participant might have and inform the participant that they may specify exactly what can and cannot be said by study staff for each locator contact. Staff may offer the participant the opportunity to have a study staff use a code name rather than the actual study staff's name when making contact, or offer the participant the opportunity to use a study-specific email account on a public website, such as Yahoo Mail or Gmail, specifically for use in communicating with study staff. Staff will then assist them in setting up that account if necessary. It is important to note that the participant will need a Gmail address once randomized to manage the Fitbit data downloads. So, this would be a good time to set one up if they don't have one already. Consider creating a Gmail account that is study-specific, such as CTN 152 plus the site code plus the participant's last 4 of the ID at gmail.com. This study requires that the participant be willing to allow research staff to obtain access to clinic records or obtain confirmation from buprenorphine providers for purposes of verifying the participant is receiving buprenorphine for treatment of OUD, the date initiated, and the current dosage. In addition, study staff should attempt to obtain a release of information for each person or entity named on the participant's locator information form, as well as to the clinic staff working with the participant to coordinate for purposes of study retention and in case of emergency or mandatory reporting situations. Other releases may be obtained as needed to obtain records associated with adverse events or serious adverse events, and any new persons or agencies added to the locator form in future visits. The eClinical system will assign the participant's user ID and password for participant self-assessments in ePro upon being enrolled into the system. Once they have signed into ePro for the first time, the participant will have the opportunity to change their password if desired. Study staff should have the participant write their user ID and password on an index card, which is then placed securely in an envelope and stored in their participant binder for use in case the participant is not able to remember their information at a later visit. Each site will maintain a stock of Fitbits. Sites may either designate some of these as screening baseline only, or, if preferred, they may allow participants to keep their screening Fitbit following randomization. As part of screening and baseline, each participant will be provided with a screening Fitbit following consent and asked to wear it continuously unless bathing or charging it, but especially whenever they have their longer period of intended sleep throughout the entire screening and baseline period. Ideally, a minimum of 2 days sleep data should be collected prior to randomization. Therefore, the latest day on which the Fitbit should ideally be issued is within 78 days of the initial dose of buprenorphine for this treatment episode. In the event that less than 2 days is available between consent and the close of the randomization window, study staff should contact the lead node for permission to move forward without the Fitbit data. Because the participant's study cell phone will not be issued until after randomization, study staff will sync these Fitbits to the Fitbit app on their study phone during screening. If the Fitbit is designated as screening baseline only, or if the participant fails screening and will not be randomizing, staff will ask for the screening Fitbit back. Staff will retrieve a screening Fitbit from the supply closet and log it on the study Fitbit log. Next, they will obtain a blank copy of the study equipment receipt and complete with the participant's name and date the Fitbit was issued. The participant will then sign and date the equipment receipt. Staff will then provide the Fitbit with its box and charger to the participant and show them how to charge it. They will provide them with the Fitbit instructions handout, which has been approved by the IRB, and explain that they should wear the Fitbit as much as possible and must wear it during their primary period of sleep for each day. Instruct them not to try to sync the Fitbit to their personal phone, as they will be returning it at the baseline visit. And if randomized, they will either be receiving that one or a new Fitbit to use throughout the study. Finally, study staff will sync the Fitbit to the app on the study phone. A new app account must be established for each different Fitbit. If this Fitbit has previously been assigned to a screener and retrieved for reissue, open the account associated with that Fitbit. Otherwise, establish a new app account and connect the Fitbit. Slide your thumb or finger down on the screen to activate syncing and release to sync data. There are step-by-step instructions in Module 2 of the Operations Manual, as well as a step-by-step pictorial named Fitbit Training Slides on the ctntpr.com study page. A number of screening assessments are completed in an interview format by the RA or other research staff. Many of these are commonly used in CTN research and may be familiar to you already. We'll look a little more closely at a few of these. If you have previously worked on a study led by the Ohio Valley Node, you are already familiar with the Dropout Risk Assessment form. The purpose of this form is to determine if there are any risks to the participant's ability to complete the study, and if so, the relative degree of risk involved. You will ask about each type of potential risk to completion in a conversational manner and discuss with the participant as needed. For any yes response, you must probe and discuss the issue to determine whether or not this poses a risk to completing the study. The determination of risk level is initially determined by the RA or RC with input from the remainder of the study team as needed, based on information gained by probing. Prior to finalizing entry, the RA or RC should review any questionable risks with the PI to determine whether or not any of these rule the participant out of the study. A high risk should be considered significant, one that is almost certain to prevent successful completion of the study and for which the participant has no plan to overcome. Medium risks may be less significant, but the participant's plan to overcome the risk is either not well thought out or depends on factors beyond their control. A low risk may be even less significant, or it may be just as significant as a higher risk, but the participant has a specific, reasonable plan that is likely to be successful in overcoming the risk. The study team must consider all relevant risks and provide a determination as to whether the risk will render the participant ineligible. The PRISM Suicidal and Homicidal Screening Form is a subset of the full PRISM interview, which is the psychiatric research interview for substance and mental disorders, and is focused specifically on suicide and homicide. This tool is frequently used in CTN studies. It is administered as an interview by the RA or RC in a semi-structured format. The form has 3 columns. The first column contains the probes or questions to be read to the participant verbatim. However, since it is a semi-structured interview, it is allowable to ask probes in addition to those provided on the scale. Interviewers should first use the probes as written, and if needed, ask additional questions to elicit additional information. The middle column includes coding guidelines, such as the frequency with which a symptom must occur to be considered present, and examples of specific behaviors to include or exclude when coding a symptom. The final column provides an area to code the symptom as either not answered, absent, subthreshold, or present. If unsure whether a symptom should be coded subthreshold or present, the RA or RC should consult with a qualified mental health professional. Because the PRISM only looks at suicidality in the past 6 months, a positive response will not trigger an assessment by the qualified mental health professional. However, one question of the PRISM indicates the presence of intent and plan for homicidal behavior, so it is extremely important to seek consultation if there is any question about homicidal intent. In CTN 152, a specific homicide plan that is confirmed by a qualified mental health professional renders the person ineligible. If there is a positive response to questions about homicidality, the RA will summon the study QMHP for a clinical assessment. As needed, staff will follow the agency's procedures for handling any participant who is actively homicidal. The Treatment and Research Status Form was specifically developed for use in this study to capture information about inclusion and exclusion criteria that is not captured by another study assessment. Specifically, the form captures information about treatment for opioid use disorder, willingness to be randomized, and willingness to comply with study requirements, including weekly visits. The questions should be presented in a conversational manner, not simply read verbatim to the participant. For example, staff should formulate 1 or more questions to obtain the information requested. If a response indicates that the participant is ineligible for the study, staff should determine if any follow-up clarification is needed to ensure the participant understood the question. Information regarding buprenorphine treatment should initially be completed based on self-report, then corrected as needed once confirmatory information is received from the medical records or the provider. Question 5 asks specifically to confirm that the information was either correct as self-reported or has been corrected based on medical record or provider report. If the participant is taking sublingual bupe, question 5B will ask if the participant had at least 1 urine drug screen during the screening period that was positive for bupe or norbuprenorphine. Additional urine drug screen tests may be administered as needed during screening in order to obtain a positive result for bupe. Eligibility cannot be determined until this confirmation has been obtained. There are a lot of participant self-assessments located within the ePRO system. Although some of these occur at screening only, most of them will be repeated throughout the study. This is only about half of them. On this screen, we see that participants will be completing the Modified Promise-Based Opioid Use Monitor, the Treatment Effectiveness Assessment, the Pittsburgh Sleep Quality Index, the Gastrointestinal Symptom Rating Scale, the SOWS, the Concise Health Risk Tracking Participant Rated Module or CHP, the HADS, and the PHQ. It is extremely important to review these measures prior to the end of the visit. If the CHP or PHQ-9 indicates suicidal ideation, or if the HADS indicates significant anxiety or depression, study staff will summon the qualified mental health professional who will assess for suicidal ideation with the Concise Health Risk Tracking Clinician-Rated Behavioral Module, also called the CC2. In addition, participants will be completing 2 craving scales, one for opioids and one for alcohol and other drugs. a quality of life assessment, the Phenex tobacco use history, thoughts about abstinence for alcohol, drugs, and cigarettes, self-report histories for HIV and hepatitis, a stigma scale that looks at stigma associated with the use of medications for opioid use disorder, and the cannabis use assessment. There are also several medical assessments, and both blinded and unblinded medical clinicians may conduct these assessments for screening purposes. Some of these, like the vital signs with height and weight, the prior and concomitant medications, and the blood draw, may be initially completed by appropriately trained and qualified staff other than the medical clinicians. These assessments, however, must be reviewed by the medical clinicians for resolution of any questions and for determination of eligibility. The birth control assessment and the medical and psychiatric history must be performed by one of the medical clinicians, and the medical and psychiatric history must be at minimum reviewed and signed off by a blinded or unblinded study medical clinician who is also a physician. Adverse events and serious adverse events will not be collected at the initial screening visit. However, if more than one session is required to complete the screening assessments, adverse events should be assessed at each subsequent screening session. We discussed determination of eligibility in detail in another presentation. However, just be aware that the ENRC CRF serves as the electronic database record of the eligibility status for each criterion. eClinical will auto-populate most of the items on the ENRC based on data entered into the various assessments. At the end of screening, you will review the ENRC to see if this person is provisionally eligible to move on to baseline and randomization. If any assessed criteria are unclear or need review by the PI or a medical clinician, now is the time for that. Participants who complete all screening assessments by the end of a visit but are still awaiting their screening blood lab results will be informed of eligibility to return for baseline and randomization via their preferred contact method once lab results have been returned and reviewed. Similarly, participants who complete all other screening assessments by the end of the visit but have not yet worn the Fitbit for at least 2 days should try to wait for baseline and randomization until the required Fitbit data is available. However, if the Fitbit information is not available within 80 days of the participant's initial dose of buprenorphine, study staff should contact the lead node for permission to randomize without the Fitbit data. Participants will be reimbursed for their transportation, inconvenience, and time. The form of the reimbursement is based on local convention, although use of a reloadable debit card is recommended. Participants receive a total of $130 for completing screening. If multiple sessions are needed to complete screening, reimbursement may be distributed in part at the end of each screening session or in total once the participant has completed all of the Visit SO1 procedures, according to local convention and as reflected in your local informed consent document. Participants receive the total amount for completing the screening procedures, whether or not they are eligible for randomization. The IRB-approved receipt log must be utilized to document the participant's receipt of payment for study visit completion. If the site provides multiple partial payments during screening, multiple receipts will be required. Now let's take a look at Visit SO2. The purpose of the baseline visit is to collect baseline sleep data from the Fitbit and to perform a final check of eligibility criteria prior to randomization. Participants who are provisionally eligible at the end of screening will return within 80 days, but no earlier than within 7 days of the BUP initiation to complete the baseline measures and, if eligible, to be randomized. 2 separate visits are completed on this day. Visit SO2 includes all the baseline procedures. This visit is the same day as the tentative date of randomization and must be completed within 80 days from the date of initial BUP dosing. Visit 1 includes randomization and the remaining weekly active study visit procedures not already collected during the baseline visit. This visit is the same day as the baseline visit and must be completed within 80 days, but no earlier than within 7 days from the date of initial bupe dosing. It is expected that the participant will receive their initial injection of study medication immediately following randomization. Therefore, if a participant is found eligible at the end of baseline, but beginning the study medication immediately is not possible due to circumstances outside of study staff control, study staff should set an appointment as soon as possible, within 80 days of the initial bupe dosing for this treatment episode, for the participant to return in order to complete randomization and receive the study injection. In this case, the BMC or UMC must meet again with the participant prior to randomization to confirm that they remain eligible for the study. They must again review all criteria and meet with the participant immediately prior to randomization to confirm that no new or reemergent problems have arisen that would render the participant ineligible. The BMC or UMC should ensure that the date of eligibility determination matches the date of randomization. At the baseline visit, study staff will perform a few additional assessments, including a urine drug screen, urine pregnancy test for persons who are of childbearing capacity and sexually active, the timeline followback, and any adverse events or serious adverse events that may have occurred since consent. You will also collect the screening Fitbit along with its box and charger, and then sync it with the app to obtain the sleep data. The participant has one safety assessment to complete in ePro. A brief note about the timeline followback for medications. There have been reports of patients receiving injections of extended-release buprenorphine, but then their urine drug screens do not show positive results for that. If the participant's confirmation of bupe induction records indicate receiving a monthly bupe XR injection in the past 28 days, or a weekly bupe XR injection within the past 7 days, but the UDS results are negative for bupe, staff will note the following in the comment section of the tab. Medical record confirms that bupe XR injection was received on, and then you put the date. If the participant's confirmation of bupe induction records indicate receiving those injections outside of their active window, study staff should send for additional medical records to confirm additional administration of the injection. If the medical records show the reported extended-release bupe injection was received, staff will note the following in the comment section of the tab. Medical record confirms that bupe XR injection was received on date. Please note that this does not affect eligibility, and the entry in TAP can occur post-randomization, so don't hold up randomization for these additional records. Just make sure to follow up on this and enter later. Following the completion of the baseline assessments, the RA or RC will perform a final review of the participant's eligibility as indicated on the ENRC form in eClinical. Any questions or concerns about randomizing the participant should be discussed with the PI or their designee and/or the study BMC or UMC at this time. Once all screening and baseline assessments have been completed, or once the ENRC indicates that the participant is not eligible, the BMC or UMC must make a final determination of eligibility. Whether the participant is eligible or not, the BMC or UMC must complete the MC eligibility checklist progress note to provide the final determination of eligibility. Only participants who meet all inclusion criteria and no exclusion criteria will be offered the opportunity to be randomized. Following administration of all baseline measures and just prior to randomization, the BMC or UMC should review the eligibility checklist and meet briefly with the participant to confirm eligibility for randomization. If the BMC or UMC is not a physician BMC or UMC must review the medical history CRF and co-sign as part of the determination of eligibility process. The process for downloading the Fitbit sleep data has changed a little bit since the beginning of the study due to the switch from Fitbit's data platform to the Google Health data platform. To download, log into the participant's Google Health account. The blue progress bar will indicate when the sync is complete. To manually activate syncing, hold and slide your thumb down at the top of the screen. Next, select Sleep at the bottom of the screen, or click on the moon and star icon in purple at the top. It takes a few days of data collection for the app to start giving a score for the sleep each night. So if the participant has only had the Fitbit for a couple of days, you may not see that. There are several ways to view the data that you need. You will select D for data provided day by day. You can also show the participant that they could select the other tabs at the top to view their week, month, 3-month, and year data summaries if they like. To move between days, click on the arrows next to the calendar at the top. Collect information from the screen onto a paper copy of the Fitbit Sleep Data CRF. We will be collecting the date the sleep started, the date the sleep ended, the total time asleep, and the date that they were awake during the date sleep start and date sleep end sleep period. Please note that in most cases, the date sleep started will be the day before the date indicated at the top of the screen. However, in some cases, the date start and the date end may be the same date. For example, the participant works the overnight shift, getting off work at 7 a.m. On Tuesday, they went to sleep at 11:05 a.m. and woke up at 7:05 p.m. for a total of 8 hours. The beginning and end of their primary sleep period occurred on the same calendar date. Checking the sleep timeline will tell you whether their sleep period occurred on the same calendar date or if it started on one date and ended on another. In the case on screen, we see that the person started their sleep period at 10:52 p.m. on Saturday, January 25th, and ended it at 7:33 a.m. on Sunday, January 26th. A reminder that the screening Fitbit must be returned once the participant is deemed ineligible or at baseline for those participants moving on to randomization. Staff will document the return of the screening Fitbit on the participant's equipment receipt and indicate either the return to stock or the reissue back to the participant on the Fitbit log. Participants found ineligible following baseline, or who are eligible but have decided not to continue with randomization, will receive a payment of $50 after completing the baseline segment of the visit. Randomizing participants will receive payment following the end of the Visit 01 segment of that visit. If they brought the Fitbit for data download, they receive an additional $10. We'll talk more about the rest of the baseline randomization and week 1 visit in another presentation. Please reach out to the lead team with any questions. Thanks for watching.